If you're over 60, let me ask you a very honest question. When you wake up in the morning, does your body still work with you the way it used to? Do you feel tired more easily, even when you're doing things that used to feel simple? Have you ever stepped outside, walked just a short distance, and suddenly thought, am I really just getting old? Or is something going on inside my body that I don't fully understand yet? I'm not asking this to worry you. I'm asking because for more than 30 years of working with older adults, I've heard the same sentence again and again. Doctor, I've smoked my whole life. If something bad was going to happen, it would have happened by now. Right? My name is Dr. David Warren. I'm 60 years old myself, and I'm speaking to you not only with medical knowledge, but with the understanding of someone who is walking through the very same stage of life as you. After 60, the body doesn't fall apart, but it starts operating on a different rhythm. Things your body could handle at 40 or 50 can no longer be ignored quietly. The problem is, your body rarely sends you a clear warning letter. It doesn't say, tomorrow something serious will happen. Instead, it whispers. You recover a little slower. You breathe a little more shallowly. You get tired a little sooner. You need more rest for things that once felt easy. And many of us label all of these changes with just two words, old age. But the truth is, not every change after 60 is unavoidable. Some factors are placing extra strain on the body more than it actually needs to carry. Smoking is one of them. Not in a dramatic, scare you way, not in a judgmental way, but in a very real biological sense. After 60, every harmful influence leaves a deeper mark, and every familiar habit has a bigger impact than you might expect. I'm not here to blame you, and I'm not here to say it's too late. What I want is to look at one very important question together. What is really happening inside your body if you continue to smoke every day after 60? And even more important, how much ability does your body still have to change? If you're watching this and thinking, this doctor is saying exactly what I've been wondering, then you're in the right place. We're going to talk calmly, clearly, without fear, one organ at a time, one change at a time. And yes, about real, proven hope that medicine has shown us. Part 1. Your lungs after 60. Why every cigarette feels heavier than it used to. When we're young, the lungs are like a brand new sponge. They expand easily, clean themselves quickly, and recover well after irritation. But after 60, the lungs aren't as elastic as they once were. The tiny air sacs don't open as fully. The ability to clear toxins slows down. Inflamed lung tissue takes longer to heal. So what does that mean? It means cigarette smoke doesn't just pass through and disappear anymore. It stays longer, it irritates longer, and it leaves deeper damage behind. When you smoke every day after 60, the lungs no longer have enough reserve to repair themselves in time. Damage doesn't build up slowly anymore. It accumulates faster than the body can recover. That's why so many people over 60 tell me, Doctor, I get short of breath more easily. I have to stop after walking just a little. I keep coughing and it won't go away. Talking for a long time makes me tired. This is not because you're weak, and it's not just because of age. It's because your lungs are working much harder to produce the same amount of oxygen they once delivered easily. When the lungs are tired, the heart has to work harder, the brain receives less oxygen, and the body feels fatigued, sleepy, and drained. Many people start adjusting their lives without realizing it, walking more slowly, resting more often, avoiding stairs, avoiding longer trips. And little by little, their world becomes smaller. I'm not asking you to quit smoking today, but there are 3 very practical things you can do to reduce the pressure on your lungs. First, pay attention to your breathing during the day. Is it shallow or deep? Do you hold your breath without realizing it? Second, reduce cigarettes during the times your lungs are weakest. Early in the morning, before bed, or when you're tired or already coughing. Just easing the pressure during these moments can make breathing noticeably easier. Third, practice slow, deep breathing for 5 minutes a day. Inhale through your nose. Exhale slowly through your mouth. Nothing complicated. Lungs after 60 respond best to gentleness. Let me tell you this honestly. Your lungs are not asking you to be perfect. They're simply asking you to put less strain on them. Many patients have told me, Doctor, I didn't realize how much better life feels when breathing gets easier. And it's true, when breathing is easier, you live with less fear. And most importantly, even after 60, your lungs still respond quickly to kindness. Part 2. Your heart after 60. Why smoking makes it work overtime every single day. Your heart has been beating nonstop for more than 60 years. It has carried you through work, stress, sleepless nights, joy, and worry. After 60, the heart isn't weak, but it's less flexible. The heart muscle is slightly stiffer. Blood vessels are less soft. Each beat requires more effort. When you smoke, nicotine immediately tightens blood vessels. Carbon monoxide takes the place of oxygen in your blood. That forces the heart to beat faster, beat harder, and work more just to deliver the same oxygen. At 40, the heart still had enough reserve to tolerate this. After 60, every extra strain leaves a clearer mark. The problem is, the heart rarely screams in pain. Instead, it whispers through everyday signs: unusual fatigue, shortness of breath while walking, a vague pressure in the chest, irregular heartbeats, or a feeling that something just isn't right today. Many people say, maybe it's indigestion. Maybe I didn't sleep well. But after 60, every signal from the heart deserves attention, especially if you still smoke daily. Smoking doesn't cause heart problems overnight. It wears the heart down little by little until it no longer has enough strength to compensate. You don't need to do anything extreme. First, notice your heart rate at rest. Does it feel unusually fast? Do you experience unexplained palpitations? Second, avoid smoking during the times your heart is most vulnerable. Right after waking up, right after meals, or when you're stressed or angry. Third, give your heart at least 10 minutes a day to truly rest. Sit quietly, breathe slowly, no phone, no mental pressure. After 60, the heart needs small but regular breaks. What worries me most isn't sudden heart attacks. It's the small warning signs that get ignored. Many patients later say, I wish I had paid attention sooner. Your heart isn't asking you to change everything at once. It's asking you to lighten the load day by day. And the good news is this: when smoking is reduced or stopped, the heart responds quickly. Blood pressure improves, circulation gets better, and fatigue often decreases noticeably. Part 3. Your brain after 60, how smoking quietly takes away clarity and confidence. The brain is the organ most sensitive to oxygen. Even a small reduction affects how well it works. After 60, the brain keeps working, but blood flow slows, nerve cells recover more slowly, and self-repair becomes less efficient. When you smoke, 3 things happen at once. Oxygen levels drop, blood vessels feeding the brain tighten, and inflammation increases. This doesn't cause immediate collapse. It forces the brain to work under poor conditions every day. Like an old machine running on weak electricity, it still runs but slower, hotter, and with more errors. Many people over 60 tell me, I forget simple things. I lose my train of thought mid-sentence. I can't focus on reading or TV. I feel anxious or emotionally unstable. The first reaction is usually, that's just age. But aging alone doesn't explain how fast clarity can fade. Smoking accelerates short-term memory loss, difficulty concentrating, emotional instability, and loss of confidence. The most dangerous part is this: people begin to doubt themselves. They hesitate to speak. They hesitate to decide. They hesitate to go out. Not because they've lost ability, but because they're afraid of making mistakes. You don't need to do anything complicated. First, observe your mental clarity. When do you feel sharpest? When does your mind feel foggy? Second, avoid smoking when your brain needs oxygen the most. Early mornings, during thinking, reading, or conversation, or when feeling anxious. Third, give your brain 10 minutes of true rest daily. Eyes closed, slow breathing, no screens, no news. After 60, the brain recovers best in quiet. One patient once told me, Doctor, I'm not afraid of illness. I'm afraid of losing who I am. That sentence stayed with me. Mental clarity is not just memory. It's autonomy, self-respect, confidence to live independently. And this is important. Even after 60, the brain responds when pressure is reduced. Just a little less smoke means more oxygen for your mind to work better. Part 4. Your immune system after 60. Why smoking makes you get sick more easily and recover more slowly. Your immune system is like your body's quiet security team. It's always working in the background, spotting bacteria, viruses, abnormal cells, and helping you repair after damage. When you're younger, that security team is fast to respond, strong when it attacks, efficient at cleaning things up. After 60, your immune system doesn't disappear, but it does change. It detects problems more slowly, it responds less powerfully, and it takes longer to recover after every battle. Now, when you smoke every day, cigarette smoke disrupts how immune cells do their job, creates low-grade inflammation throughout the body, and leaves your immune system both tired and distracted. So what's the result? Your body doesn't have enough strength to fight illness and heal itself at the same time. That's why so many people over 60 tell me, I'm getting sick more often lately. Everything takes longer to get over. Even a mild cold wipes me out for a whole week. Even small scrapes take forever to heal. A lot of people assume, maybe it's the weather. Maybe it's just my age. But the truth is, smoking keeps your immune system in a constant state of overload. And that leads to something very quiet, but very real. The fear of getting sick starts creeping into your life. You start feeling afraid of crowds, afraid to travel, afraid of being hospitalized, afraid of, if I get sick, who's going to take care of me? Not because you're weak, but because your body doesn't feel as safe and dependable as it used to. And you don't have to change everything all at once. First, avoid smoking when your body's basically wide open to illness. When you're sleep deprived, when you already have a cold, cough, or fever, when the weather is changing, that's when your immune system needs protection the most, not more attacks. Second, drink enough water during the day. It sounds simple, but many older adults don't drink nearly enough. Water helps blood flow more smoothly, toxins clear out more easily, immune cells work more effectively. Third, give your body real rest. Take a short nap if you need it. Stop forcing yourself to push through exhaustion. Don't shame yourself for needing more rest. After 60, rest is part of treatment. I've had many patients tell me, Doctor, I'm not afraid of a serious illness. I'm afraid of these small problems that never end. And they're right. Those long-lasting, nagging illnesses steal your energy, steal your confidence, and steal your sense of control. The good news is, your immune system responds fairly quickly when you cut back on smoking. Less inflammation, fewer minor illnesses, faster recovery after you get sick. Your body isn't asking for perfection. It's just asking you to stop exhausting it every single day. Part 5, Cancer and Life After 60. The truth, the fear, and real hope. As we get older, our cells don't divide as perfectly as they used to. That's a normal part of aging. Usually, your body has systems that repair DNA mistakes, remove abnormal cells, stop them from growing out of control. But after 60, that repair system becomes slower and less efficient. When you smoke, cigarette smoke brings in chemicals that directly damage DNA, triggers that increase inflammation, signals that push cells in the wrong direction. And the dangerous part is this: cancer doesn't show up overnight. It can grow quietly for years, especially when the body can't correct mistakes fast enough. When people over 60 think about cancer, the biggest fear is often not death. It's becoming dependent, long rounds of treatment. A weakened body, a life that gets turned upside down. Many people tell me, Doctor, I'm not afraid of living less. I'm afraid of living and not feeling like myself. Smoking-related cancers often get discovered later, are harder to treat in older adults, take longer to recover from, affect daily life more dramatically. But here's what you must know. Not everyone who smokes after 60 will get cancer, and it's absolutely not true to think quitting now won't change anything. You don't need to do anything extreme. First, don't ignore unusual changes, a cough that won't go away, unexplained weight loss, a hoarse voice, blood where it shouldn't be. After 60, listening to your body is a survival skill. Second, cut down on cigarettes if you can. Every time you reduce, you lower the toxin load. Reduce pressure on your cell repair system. Give your body more time to protect itself. Third, don't isolate yourself because of fear. Fear doesn't make cancer disappear, but awareness and action can lower risk. I've seen patients quit at 65, 70, even later, and I've seen fewer complications treatment that feels more manageable. Stronger mental resilience. What I want you to remember is this. Your past does not lock up your future. Your body doesn't ask, why didn't you change sooner? It only asks, are you willing to do something better for me today? Part 6. Quality of life and independence after 60. What smoking quietly takes away. After 60, the biggest goal isn't just living longer, it's living well, feeling free, comfortable, and capable in your everyday life. At this stage, the body has less energy reserve, recovers more slowly from fatigue, becomes more sensitive to stress, poor sleep, and low oxygen. Smoking hits that entire system at once. It makes sleep lighter and easier to disrupt. It keeps the nervous system more tense. It creates a mild but constant oxygen shortage to muscles in the brain. It's not one big ooter, it's a slow drain, little by little every day. That's why many people over 60 don't say, I'm sick. They say, I don't really feel like going anywhere anymore. Going out makes me tired. I feel safer staying home. It sounds normal, but underneath it often means fear of getting short of breath, fear of crashing halfway through, fear of bothering others, fear of not being able to control your body. So you start doing things like choosing seats near the exit, avoiding stairs, turning down trips, shrinking your life to feel safe. Smoking doesn't take your life away instantly. It takes away your good days. Before you even realize it, you don't have to change who you are. First, ask yourself once a week, what have I stopped doing because I'm afraid I'll get tired? If that list keeps growing, that's an important signal. Second, don't smoke right before important activities. Going out, seeing family, walking, doing anything that needs focus, you'll be surprised how much better your body cooperates when you don't smoke right beforehand. Third, protect your sleep like it's medicine. Don't smoke close to bedtime. Breathe slowly before lying down. Give your body real quiet. Good sleep helps. Energy return. Mood stabilize. Confidence come back. I've heard many patients say, Doctor, I don't need more years. I just want better days. And I believe that. Quality of life doesn't live in lab results. It lives in, do you feel brave enough to walk? Do you feel safe enough to go out? Do you still trust your body? Cutting back isn't giving up. It's protecting the days that matter. Part 7. What happens when you cut back or quit after 60? Changes over time. There's a very common belief I've heard for years. Doctor, I'm older now. Changing won't help. That's simply not true biologically. The human body, even after 60, is still capable of adapting. Yes, it's slower than before, but it's not stuck. When you cut back or stop smoking, the toxin load drops immediately. That allows the heart to carry less strain, the lungs to begin cleaning themselves, the brain to receive steadier oxygen, the immune system to calm down. Your body doesn't need perfection. It just needs less smoke than yesterday. After the first few days, oxygen levels rise. The heart doesn't have to overcompensate as much. Many people feel they can breathe deeper and feel lighter in the chest. After a few weeks, circulation improves, hands and feet feel warmer, coughing and mucus often decrease. Sleep becomes deeper after a few months. The lungs keep clearing trapped buildup. Fewer minor illnesses, faster recovery from fatigue, more stable mood. And here's what matters. These changes are often the most noticeable in older adults because the body has been under pressure for so long. You don't have to say, I'm quitting completely today. You can start small. Step 1, pick one time of day you won't smoke, early morning or before bed. Step 2, watch how your body responds. Is breathing easier? Is sleep deeper? Is fatigue lower? Step 3, hold on to those improvements. Feeling better is what pulls you forward, not pressure. After 60, the body learns through experience, not commands. I've watched many older adults change this way, not with extreme willpower, but with one simple thought: maybe I should be a little kinder to my body. And that kindness brings hope, confidence, a sense of control again. Your body doesn't ask, "Why did you smoke so long?" It asks, "Are you willing to make my load lighter today?" Closing, if you've listened this far, I want you to know something important. It means you still care about yourself. After 60, the body doesn't stay quiet and tolerate things the way it used to. It speaks through fatigue, shorter breath, slower recovery, worries you never used to have. Smoking isn't a simple right or wrong story. It's a story about the strain your body carries every day. Remember what we covered. Your lungs need oxygen, not extra burden. Your heart needs gentleness, not constant pressure. Your brain needs healthy flow, not low oxygen. Your immune system needs recovery, not overload. And your quality of life needs confidence, not quiet fear. The most important truth is this: your body is still responding, even after 60. No one is asking you to be perfect. No one is asking you to change everything in one day. Just less smoke, less strain, less damage than yesterday, and your body will thank you. If this video helped you understand your body more clearly, subscribe so we can keep having calm, honest, judgment-free conversations like this every day. I'm Dr. David Warren, and I truly believe this. Health isn't just about living longer, it's about living better days. Disclaimer: this video is for educational purposes only and does not replace personal medical advice. Please talk with your doctor about your specific health situation.